There's a continuum of grief and the ways that we grieve. One style of grief is called intuitive, and it's often associated with women, although many men can also experience an intuitive grief style. Intuitive grievers are generally focused on emotions and tend to utilise support networks more. Whereas on the other end of the spectrum, the instrumental grievers, who are generally men, are task-focused and prefer to have something to keep their minds occupied. Sometimes grieving in very different ways can cause difficulties in a relationship. Intuitive grievers tend to have more physical symptoms of grief, such as a change in appetite, a reduced interest in sex, or more physical illnesses. Instrumental grievers might isolate themselves and want to remain focused on having something to do, rather than utilising grief support services. Parents often tell me that before their child died, they always expected that they and their partner would support each other in mourning. However, the reality sometimes turns out that the mother and the father have two completely different grieving styles. You might wonder why your partner constantly wants to talk about the death of your child and relive certain crisis points, whereas you'd prefer not to think about it. Or you might wonder why your partner has returned to work so quickly after the death of your child, while you can't even contemplate returning to work. When you've expected to grieve together, this marked difference in grieving styles can be very painful and can be an additional loss that the couple has to manage. These different styles of grieving can help to explain some of our behaviour when we grieve. There's no right or wrong way to grieve, and it's important to give yourself and your partner space to grieve in the way that works for you. It can sometimes be disheartening to feel that you're on different paths in your grief. The important thing to remember is that you're both individuals with individual needs and ways of expressing your emotions.